Hey everyone, it's Dr. John Burroughs at Springs Aesthetics. I wanted to briefly go over what's called a lower eyelid skin pinch blepharoplasty. So this is a good surgery to perform for folks that are concerned about lower eyelid wrinkles, who don't really have extra fat as the problem pushing forward. It's also great in younger patients because the incision heals quickly and it makes a big difference as far as smoothing things out. It also, under certain circumstances, can improve the tear trough deformities that can get dark and are often described as the circles that we get under our eyes with allergies or if we're tired. And in some people it runs in the family that everybody kind of has those kinds of eyes. So what is a blepharoplasty? Blepharoplasty means plastic surgery to reform the eyelids, and that's all it means. So when we talk about the skin pinch, we're talking about pinching the skin with a forceps to loosen it and pull it above the muscle that runs along the lower eyelid margin. It's great because you want to keep that muscle intact whenever possible, especially here in Colorado where our dry, arid environment can cause really significant dry eyes. So when you do a lower eyelid skin pinch blepharoplasty, you make a small incision a few millimeters below the lash line, and it's a nice place to hide it. You use those forceps to pinch the tissue, which causes the amount that you can generally take out safely to be pulled upward. And then you use a pair of scissors to snip along the area you pulled up. And that just leaves a small strip of the skin that's been removed. You then can suture it with either dissolving sutures or a suture type that you remove. Now, in older patients that don't have a lot of tension along their lid margin and they're really stretchy, you need to support the outer canthus, which is the outer corner of where the eyelids come together. Also, some patients like to have their eye shape changed a little bit to make it more almond shaped or to kind of give a cat eye appearance. But it's also important to do a lateral canthopexy even if the skin does snap back easily and have good appropriate location and tension, because when you take skin out from under the eye, you want to avoid what's called retraction, where underneath the colored part of the eye, the cornea there, you start to see a lot of white scleral show, because that's not an aesthetic appearance that people want, nor is it good for the way your eyes feel, because they'll become more bloodshot and they will feel more dry and irritated. So you can see before her surgery, she had a nice shape, and however, she didn't like these deep folds here, and she had some darkening starting to develop over the what we call the tear trough deformity. So we did the skin pinch blepharoplasty as shown here, and that helped pull the skin more taut so it smoothed the wrinkles, and then it also slightly helped the tear trough depression. Now in some patients you can put fat there or filler to help smooth that out, but her main thing was the wrinkles. And then we also supported her lateral canthus, and the way you do that is you make a small little incision right at the corner, and you can lasso this lower eyelid tendon with a suture and then attach it to the orbital rim just a little bit behind the edge there, and that will stabilize the lid. Or if you want to change the shape, you suture it up a little bit higher along the rim to give a little bit of an angle. So she was very pleased with the result. It's a quick, fast recovery, and this is only about 5-6 weeks afterwards, and you can't even really see where the incision was, so she was extremely happy. I hope everybody found this useful and helpful, and if you need help with your eyelids, find an oculoplastic surgeon. And on behalf of my Springs Aesthetics team, thanks for viewing, and if you found this helpful, please like it, share it, and follow it. Everybody have a great day.